Okay, in this video we're going to show how to work with the right side of our patient. So she's laid down the left side. Now, here we have the convexity of the thoracic spine in the right side and the concavity in the lower side. So if we want to open more the concavity and correct more the patient in the left side, we are going to ask her to bring her upper extremity in 180 degrees abduction. Most of the people are able to do this without any problem. And what will happen is that our patient's convexity will open up. Okay, so here is the convexity, and while she's doing an upper abduction of the shoulder, the convexity and the concavity is opening up. So we have a correction in the frontal plane. Now we have to correct the lumbar region, and we are going to bring a small, like a towel or a ball at the lumbar part of our patient. Perfect. Because here we had the concavity in the lower part, in the left side. So if we want to open the concavity, we have to put a towel or an object to push the convexity in the right side and open the concavity in the right side. So here in the convexity, here's the concavity, okay? And of course, we know at the concave part of the lumbar spine, we have elevation of the pelvis. So how we are going to correct the elevation of the pelvis is by asking the patient to extend her right leg, and we can bring the leg in a ball or another object as you have in your clinic, and then you see that the concavity is opening extremely here. So we are pushing from the convex side, we are opening, and we are extending the leg, so we are opening maximally the concavity of the lumbar part. The left leg is flexed in the hip 90 degrees. So as you could see, it's the same position that we did in the other way, so when we had the patient lay down on the right side, okay? So here how we are going to work. So we corrected the patient in the frontal plane. Our patient in this case, she is corrected in the sagittal plane because she doesn't have hyperlordosis or hyperkyphosis. But also with the abduction or flexion of 180 degrees, we have extension of the thoracic spine. Now we are going to ask the patient, in the beginning, we are going to ask the patient to correct and work with the lumbar spine. It's easier for the patient to understand. So I'm going to ask the patient to push the leg with her feet, like she has a wall on her feet. Just push her leg down, great. And now she's opening more the concavity. And now she can breathe in and breathe out. So while she's breathing, she's opening more the concavity of the lumbar spine. What can happen is this. Can you relax, please? Thanks. Some people can push the leg and go in hyperlordosis. So you have to be very careful while they're pushing the leg to be in a retroversion or posterior tilt of the pelvis. So flex the other leg a little bit more, okay? Okay, so push, keep here, and I can even help her and just breathe in. Breathe, 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 breathe. And relax. Perfect. Try to breathe here. Try to breathe on my hand. Great. What I'm going to do when I say squeeze, when I'm squeezing her in the abdominal region, and I'm just asking her to focus her breathing on the belly. So you could see now that the belly is opening. Okay. So she relax. Perfect. Push the leg down. I'm squeezing her here, and I'm just saying, breathe in on my hand. Perfect. And relax. And again, breathe in on my hand here. Breathe, 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 breathe. Perfect. And she can breathe like 5 times here. While she's breathing in, the muscles are stretching of the concave side, okay? Perfect. Relax. Now she learned this. And I'm going to teach her how to rotate the thoracic spine. I'm going to leave the pelvis alone for the moment. And I'm going to ask the patient, now, in the thoracic spine, we know that in the convex side, the ribs are rotated posteriorly, okay, and opened posteriorly. What I want to do to correct the thoracic spine is to rotate the ribs anteriorly. So I want to rotate the whole thoracic or the whole diaphragmatic cage in a way, the thorax, anteriorly. So I can ask her like to bring her right breast towards the bed, okay? So I can ask her to rotate. If she doesn't understand how to do it, you can bring your hands here and just ask the patient, rotate, 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 rotate. Okay, perfect. She's doing it perfectly, so it's fine. But what a lot of people will do is this. They will rotate and they will just do the flexion again. So it means they are going to they are not bringing the ribs anteriorly, but they're just pushing the ribs again posteriorly. You don't want to flex the thoracic spine. You want to extend the thoracic spine and then rotate the thoracic spine, okay? Two things, first of all. Second of all, they can do this, that while they are rotating, they are trying to rotate, they are not rotating, but just extending the lumbar spine, okay? Again, be careful. Or some other times they are rotating and then just going to bring the scapula and the shoulder in an elevation. So these are some tricks that you have to be careful while you're doing the rotation. Okay, so bring your hands on the right side of the ribs and ask your patient to rotate. With this hand, I'm just showing her, can you bring the hand like this? I'm just showing her how to rotate. It's like I'm rubbing her and showing her you have to rotate anteriorly, okay? Perfect. So, one hand here, one hand here. With this hand, I'm just teaching her to go in extension and not in flexion, okay? So you have to, in a way, rub caudally. So what I will do is this. Rotate, perfect, rotate. Great, 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 great. Rotate, rotate, rotate. Now, a lot of people, when you see that the scapula is going in elevation and protraction, I'm going to ask them, bring your shoulder down. Great. And again, rotate, rotate, rotate. If they don't know how to do this, then you can bring the shoulder like this, here. Here. Okay? Keep it like this, please, and try to rotate. Perfect. Rotate, rotate, rotate. Bring your shoulder down. Perfect. Now, while I'm bringing the shoulder down, I'm pushing the ribs anteriorly, okay? Because it's impossible to do it differently, okay? But our patient is able to do it with this hand like that. So, come, front, 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 bring your shoulder down. Perfect, perfect. And now breathe in and breathe out. And be careful while she's breathing in, not to go in flexion, okay? And after you teach this here to her, you're going to combine the thoracic spine and lumbar spine together. So, I'm going to ask the patient to rotate her thoracic or her ribs forward. Rotate. Great, 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 great. Bring your shoulder down. Great. Now, bring your right leg down and stay in this position. So, I'm opening also the concavity here. She's rotating forward. And now breathe in to the belly. Breathe in. I'm squeezing her abdominal muscles. Breathe in. Perfect. Breathe in. Perfect. And relax. And when you are squeezing the abdominal muscles, you feel a contraction of the core. It's not just breathing in with relaxation. But if your patient doesn't understand it, then it can be just relaxation, okay? So again, rotate, rotate, rotate. No, leave the pelvis alone. Let's start with thoracic spine. Rotate your thoracic spine. Perfect, that's enough. Depress. Now, bring the leg down, okay? And breathe in. And breathe out. And you see, you can also do it like this, okay? Like that. No. Relax here. Perfect. Rotate a little bit more forward. Perfect. Your scapula should be in depression. Perfect. Stay here. Breathe in. And breathe out. And you can rotate even more forward. Perfect. And even more forward. And even more forward. So here you are rotating forward, here rotating backwards, and she's breathing in her belly, okay? She's activating her core and her diaphragm. Because most of the times also, just stay a little bit in this position, most of the times when a patient has convexity in the right side, her lower ribs The lower ribs, most of the times are compressed, you know, they are not open. The gibbus is not from the lower ribs to the upper ribs. The gibbus is most of the times at the upper part of the thorax. So the lower ribs most of the times are compressed. So in this position, you are also opening the lower ribs and you are opening the concavity a lot, and you are stretching the quadratus lumborum muscle, which is always contracted in the concave side of the lumbar region. Okay, and you can do the same thing here, like 10 repetitions with 3 inspirations and expirations. Relax, try again. It's very important not to stay in one position and just breathe in and breathe out. It's important for us to learn the patient to move towards the correction. So it's important for me to learn her how to rotate her ribs and how to push the leg down, okay? Because all the other exercises that we're going to do are with the same principle. Rotating the ribs, pushing the leg forward, down, depending on the side. And if I learn her this in the spine or in the lateral position, horizontal plane, it's easier for her to do this in vertical position, okay? So be very careful in the first session to really stay in this position and explain to the patient where she has to rotate, how to rotate, and where to breathe in, okay? So we are going to do now the exercise in seated position.